Welcome, we will present the second series of the book, American Psychiatry After World War II, 1944 to 1994. Been the talented and perspicacious staff members of the Menninger Clinic Professional Library. Mary Austin, Alice Brand Bartlett, Lois Bogia, Nancy Bauer, Andy Burgett, Krista Comley, Judy Cash, and Linda Nelson. No citation or reference proved too obscure, too scanty, or too old to escape their vigilant attention. Their willingness to respond to repeated requests for yet another literature search was itself an inspiration. Of particular assistance as well was Paul Arrigo, the reference coordinator and government documents librarian at the Washburn University School of Law Library, whose familiarity with the legal literature proved invaluable. Bringing this work to fruition would certainly not have been possible without the expertise, encouragement, patience, and support of the editorial staff of the American Psychiatric Press, Inc., from Carol Nadelson to Claire Reinberg to Pam Harley, as well as many others who labored to ensure its completion. Lastly, Rosemary Hall Evans warrants a special tribute of appreciation for her bounteous New England hospitality and encouragement that nourished the muse during several long periods of this protracted work in progress. We gratefully acknowledge that publication of American Psychiatry After World War II was made possible in part through a grant from the American Psychiatric Foundation. History plays a signal role in the clinical work of psychiatrists. Attending to a patient's presenting complaints brings hints and reminders that the current symptoms are expressions of events that have gone before, often a long time before. For this reason, few clinicians undertake treatment without an initial scrutiny of the patient's history. For some clinicians, such an examination may be a perfunctory review of behavioral change or symptom appearance and evolution. More experienced clinicians, however, regularly undertake extended study of their patients' life stories. Their earliest experiences, feelings, and memories, descriptions of their parents, siblings, and relationships among them, their educational, social, and work history, in short, a comprehensive longitudinal survey of the patient's life. For most practitioners, the history of the patient's problems or illness is an essential ingredient for an adequate understanding of the origin and evolution of a clinical problem. Even as our understanding of etiology evolves from earlier presumptions of single-agent causes, from constitution to biology to psychodynamics, to neurobiochemistry, to genetics, and perhaps ultimately to a grudging recognition that it is all of the above and more. History, the patterns of events and related thoughts and feelings, provides the context in which diagnosis and treatment proceed. History illuminates critical motivations, delayed maturational issues, and unresolved conflicts. To practice clinical psychiatry without extensive history-taking is to set off on a journey without a map. The history of the discipline of psychiatry, however, is a different matter. To many, it seems little more than an accumulation of information that is terribly outdated or misguided or just plain wrong. Only potentially interesting in a quaint way, and, in any case, irrelevant to the fast-paced patterns of today's world. The history of the discipline does not seem especially helpful in the management of clinical problems confronting the average practitioner. It does not contribute to a better understanding of the diagnostic and therapeutic options in the field. Consequently, the history of psychiatry is relegated to a dusty corner of the intellectual work world of the practicing professional, briefly appearing as part of a celebratory presentation for the opening of a new building, or the marking of an institutional anniversary. A few professional training programs and some thoughtful senior clinicians offer occasional history lectures to beginning residents in the field. We thank you for following us. We will meet in series number 3. Please support the channel by subscribing and pressing the bell button to receive the new